Hello everyone, my name is Shahnaz and I welcome you all to my channel Nurses, the Heart of Healthcare. I would really appreciate if you all subscribe my channel Nurses, the Heart of Healthcare. I'll try my best and I hope and pray that all my videos are helpful to all the nursing students and the various medical staff working in the various healthcare settings around the world. My last video was regarding the 6 C's of nursing. 6 C's of nursing which are very important for all the nurses to embrace to provide high standard care to all their patients. That is care, compassion, competence, communication, courage and commitment. So I hope you all find it helpful and start practicing it in your field. Now, this video and today's class is regarding, as you can see here, the 10 R's. 10 R's or the 10 rights of medication administration. 10 R's or 10 rights of medication administration or drug administration, whatever you say. Now first coming to what is medication. What is medication? Medication is nothing but any substance which is given to a person for diagnosis, treatment, cure, prevention of disease or for relief of a symptom. Okay, so medication is any substance which is given for the diagnosis purpose, for treatment or cure a condition, like antibiotics are given to treat infection, heparin is given to treat diabetes, then prevention of disease or illness, like vaccinations are being given for a potential virus, then for relief or reduce of a symptom, like antipyretics are given to reduce the fever. Okay, so this is the purpose why a medication is given to a particular person. Now medication administration is nothing but the process or the manner in which the medicine is given to the patient, and nurses play a very vital role in medication administration. Medication administration is the basic nursing function which involves, or you can say which requires, knowledge and skills. Okay, nurses play a very unique and important role in medication administration, because usually or frequently you can say nurses are the final person to check that the medication is prescribed and dispensed correctly before it is being administered to the patient. So nurses play a very vital role and to ensure that the medications are given safely to the patient, because see, medicine, the purpose of medication is to improve the health of a person. Yes, to improve the health of a person. But if it is not given correctly, then it can worsen a patient's condition. It can be dangerous, it can be fatal, and sometimes it can cause permanent disability. So that's the reason professional training is required for medication administration, and it is a standard that during nursing education all the nurses are being instructed on the guide of medication administration and trained on medication administration. And here comes the 10 R's or the 10 rights of medication administration, which must be followed by all the nurses to ensure safe administration of medication. These 10 rights not only protects the patient from the medication error harm, but also they protect the interest of the patient as well as the nurse administering it. Okay, so let's see what are the 10 R's. Initially they were 5 R's, 5 rights. Later on the experts have expanded it to 10 R's. So let's see what are the 10 R's. The 10 R's of medication administration are right patient, right medication or right drug, right dose, right route, right time, right patient education, right documentation, right to refuse, right assessment and right evaluation. Okay, so these are the 10 R's or the 10 rights of medication administration that must be followed while giving medicine to a particular patient to ensure safe administration and to achieve the purpose of medication. Okay, so now we'll discuss each one in detail. Okay, now first coming to the right patient. The first right is right patient. Okay, so whenever a medicine is prescribed, the nurse should ensure that she's administering the medication to the right patient. And here she need to use two identifiers, at least two identifiers to make sure it is right patient. Okay, so what they should do is the nurse should ask, even the nurse knows the patient name, she should ask the person to to identify himself or herself, to repeat his full name. Okay, it is advisable not to address the patient with their first name or surname, because there is a possibility that there can be two or more patients with the same name in the same unit. Okay, so that's the reason you should not address the patient with their only surname or the first name. Okay, so first you will ask the patient to identify himself or herself, to tell it to repeat his name, and then you will compare it with the name on the prescription or the medicine order and on the medical wristband. The patient will be wearing a medical wristband when they are inpatient. Okay, so you have to compare their name on that. Okay, and then you also match their ID numbers. The patients will have the unique patient identity number. That also should be matched to ensure that you're giving medicine to the right patient. Okay, so this sounds very simple, but in case of psychiatric patient, think that you have a psychiatric patient, then how you will do this? When you're dealing with a psychiatry patient, okay, so their altered mentation, because of their altered mentation, they may not be able to identify themselves correctly. Okay, and they may not be wearing the medical wristband too. Then that time the nurses should opt for the alternate ways to make sure that they are giving medication to their right patient. Okay, and in case of neonates and toddlers, they will not be able to tell their name, so they have to depend on their medical wristbands, and they have to check with the medication sheet and the prescription order correctly. Okay, so ensure that you're giving medication to the right patient. Then the next right is right medication. Okay, whenever a medication is prescribed, okay, you have to check and verify that it is the right name and right form. Okay, and here nurses should be they should be aware of something called the LASA drugs. LASA drugs, LASA drugs. Okay, so LASA stands for look alike and sound alike medications. Okay, so this can cause confusion when they are misread or misheard. So that's the reason nurses should be well aware of the LASA drugs, and they have to be careful when they are administering the medication. Look alike and sound alike medications are nothing but those medicines which either they look similar in their packaging, or they sound similar with their generic name or the brand name. Okay, and when they are misread, it can cause a great confusion and can be harmful to the patient. Okay, they can be similar in their spellings, they can be similar sounding, or they can be similar in packaging. So we need to be very careful. So I have given here some examples, as you can see here. See, diltiazem, diazepam. Diltiazem, diazepam. Diltiazem is a calcium channel blocker which is used to decrease blood pressure and to control angina, whereas diazepam is benzodiazepine anxiolytic which is used to treat anxiety patients, seizures, alcohol withdrawal syndrome, etc. Next example of the LASA drugs, as you can see here, is dexamethasone and dextromethorphan. Okay, dexamethasone is a corticosteroid, okay, which is used to decrease inflammation. Okay, whereas dextromethorphan, it is an antitussive, it is a cough depressant which is available as OTC medication, over the counter medication. See, lot of difference. This will not be available without prescription, and this will be available with this will get only with prescription, and this you can get without prescription also. Okay, the next example of the LASA drug is cardapine and carbapine. Cardapine is antihypertensive which is used to treat high blood pressure, whereas carbapine, it is an anti-epileptic agent. Okay, so there is a lot of difference again. And see here, one more example is propranolol, which is propranolol and propofol. Propranolol is a beta blocker, okay, which is used to decrease the heart rate, whereas propofol is used in patient control analgesia, okay, as a sedative. Fine. So these are some examples of the LASA drugs, look-alike and sound-alike medication. To ensure that you are giving right medication for this ride, you must be aware of the LASA drugs, okay, and always cross-check with the drug order, for the right name and for the right form, to make sure that you are giving the right medication. Then The next right is right dose. Okay, right dose. To ensure this right, nurses should be aware of the difference between pediatric doses and adult doses. Okay, there is a difference between the dose of that is given to the kids and the dose that is given to the adults and the elderly. So they should be aware of it, and there are doses which are given according to the weight and age. So nurses should be aware of this, and they should check the medication sheet and the doctor's order before medicating. Incorrect dosage, conversation of the units, and incorrect substance concentration are the prevalent modalities of medication administration error. Incorrect glance at a unit abbreviation, like see sometimes when you're giving an incorrect glance, like in reading mcg versus mg, microgram versus milligram. Okay, so this can cause a confusion and wrong dose can be administered, which should not happen. Okay, so to avoid this, nurses should adopt some positive behaviors. And what is that? That is to decrease the medication administration errors related to the dose and the medication. The nurses should consult the pharmacy personnel whenever they have any doubt. Okay, so if you have any doubt related to the medication, please consult the pharmacy personnel, okay, and clear the doubts, and use a calculator to assist in the calculations. Okay, always calculate the dose, drug dose properly, and have another nurse calculate it to cross check or to double check that what you have calculated is correct. And what you do is cross consult with the patient and their families about their usual doses that they used to administer at home. Okay, so these all must be done to ensure that right dose is given to the patient. Okay, then the next right is right route. Right route. See, medications can be given to the patient in different ways, and some of the common routes of giving medications are oral, intramuscular, intravenous, topical, subcutaneous, rectal, vaginal. And some modern medicines, they are given through central venous catheters, patient control analgesia, epidural infusions, and intrathecal administrations. Okay, so it is very important, crucial for the nurses to remain educated and to remain up to date on the newer medication. Okay, nurses should have at least minimum basic understanding of the physiology influencing the drug absorption rates and the time of drug onset. See, for example, the medicines that are given intravenously, okay, they have higher bioavailability because they are introduced directly into the venous circulation, whereas the medicines that are given orally, okay, first they need to go through the digestion, absorption, and then the filtration through hepatic circulation. Okay, so it's a long process. So IV medications, they have faster bioavailability. So this basic knowledge the nurses should have when they are administering the medication. The next right is right time. Okay, the next right is right time. Medication should be administered at the right time. Administering medication at the proper time is very important. Okay, medication should be prescribed as closely to the time as possible, and the nurses should ensure that they do not deviate from this time by more than half an hour. Okay, to avoid the consequences such as altering the bioavailability or the other chemical mechanisms. Okay, so it is very important that the medications are administered at right time and at correct rate, especially those medicines which are given through IV. Okay, intravenous medication, they should be ensured that they are given at correct rate. So you have to calculate the fluid, the drop factor properly, and then they should be administered at correct rate. For example, if you can take vancomycin, which is a glycopeptide antibiotic, okay, this requires administration slowly. Okay, so vancomycin should be administered through IV slowly, okay, to avoid vancomycin flushing syndrome. Fine. So if it is administered at a faster rate, then it can cause problem to the patient or a hypersensitivity reaction to the patient. So that's the reason medicine should be administered at proper time, at the correct time given, at proper frequency, okay, and at the correct rate. Double check that you are giving the prescribed medication at the correct time and confirm when the last dose was given, because 60% of the medication administration errors happen in terms of or in the form of wrong dose, wrong route and wrong time. Okay, so make sure that we do not become a part of these medication administration errors. Next right is right patient education. Okay, right patient education, you should provide enough knowledge to the patient that what is expected, I mean what is the therapeutic action and the side effects of the medicine that you're giving. Okay, and check that the patient is understanding what the medication is given for. Okay, they should be aware of the therapeutic effect as well as the side effects of the medicine that is going that we are giving to them. Okay, next right is right documentation. Okay, once the medicine is given, the nurse should make sure that she is signing it after administering. And also regarding the documentation, the medicine should have the correct proper date and time when it was started and when they have stopped it, and if they have made any changes in its dose and frequency. It's very important. Okay, so this should be properly documented. Proper documentation is very important. Then next right is right to refuse. Okay, so please keep in mind that the patients have the right to refuse the medication if they have the capacity to do so. So ensure that you have the patient consent to administer the medication. Then the next right is right assessment. Right assessment is check that your patient actually needs the medication and check for the contraindication, baseline observation if required. Okay. Then the next right is right evaluation. Right evaluation is ensure that the medication is working the way it should. Ensure that the medication has been reviewed regularly. Okay, and after giving the medication, you have to see whether the medication is having a therapeutic effect or is there are any side effects or adverse effects. Okay, and all this must be reported. So these are the 10 R's or the 10 rights of medication administration that we must follow. Okay, so now coming to the summary of this. So this video is concluded now. Okay, the safe and accurate administration of medicine is the nurse's most important and prime responsibility, and nurses should not merely follow the prescription blindly. They should always check with the pharmacy personnel as well as the prescriber if they have any doubt. Okay, see, medicine, though the purpose of medication, as I told before also, though the purpose of medication is to improve the person's health, to cure, to treat and to relieve from a particular symptom, but if they are given incorrectly, it can worsen the person's condition. Okay, it can be dangerous, it can be fatal, or sometimes it can cause permanent disability. So please follow this 10 R's to make sure that the patients are safe and we are also safe. Okay, so thanks for watching. Hope you find it helpful. Please like, share and subscribe my videos.